Now, let's start with the antipsychotic drugs. As I said you that antipsychotic drugs, these drugs are also called as the neuroleptic drugs. Neuroleptic drugs. Another example is also called as the major tranquilizer. Major tranquilizers. Why I am giving you the alternative names? Because in the MCQ you can come across the another name for the neuroleptic. You can another name of the antipsychotic drugs. You can find it as a neuroleptic or major tranquilizer. On that very moment, if you don't know the alternative names, you can say mistakenly take the wrong answer. So for that, you have to keep in your mind that antipsychotic drugs is also called as the neuroleptic drugs, and it is also called as the major tranquilizers. Fine. Now, coming to the another point about these antipsychotic drugs, these drugs are commonly used to manage the psychiatric, you can say the psychosis. Okay, psychosis. And as I said you that the classical example, okay, or psychosis is commonly seen in the case of schizophrenia, or also called as schizophrenia. Schizophrenia. So first we will see the symptom of the schizophrenia, okay, and then we will move with the antipsychotic drugs classification. So the schizophrenia symptoms is classified, okay, for ease of study. These symptoms is classified into the two types, okay. The one category of symptoms is called as the positive symptoms, okay. Another category of symptoms is called as the negative symptoms. So we have the positive symptoms, okay, and we have another symptoms called as negative symptom. And it's very easy to understand that the positive symptom means there are, you can say, a certain behavior which is added in a person, a psychiatric person, the schizophrenic patient basically, okay, and there are some natural behavior, okay, which is after getting this disease eventually lost from the person, okay. So what things added, okay, what is additional behavior? The additional behavior is the schizophrenic patient, they develop the hallucination, okay. Mostly the two types of hallucination is commonly seen in the case of the schizophrenic patient. The one is called as the auditory hallucination. Auditory hallucination, it is the sound, okay, the patient is continuously hearing the sound, okay, but for a normal person this sound is not available. This is especially available for this schizophrenic patient, okay. This is called as the auditory hallucination. This is called as the auditory hallucination. Apart from that, there is another kind of hallucination which is commonly you can say seen in the case of, you can say, the schizophrenic patient, and also the you can say the cocaine abusers. Cocaine abusers also feel, and that category of hallucination is called as it is called as the tactile hallucination. It is called as the tactile hallucination, means sensation over the skin. Patient feel that there is something which is running over their skin, okay. In the cocaine abusers, they find out that there are bugs, okay, which is there, and so they are doing like, okay, fine, we are understanding the thing. This is called as the tactile hallucination. So these are the two prominent, you can say, the type of hallucination which is commonly seen in the case of schizophrenia. The another thing which is present, which is added in the, you can say, the schizophrenic patient personality, and that is called as the disturbed thought, okay. So there is a severe thought disturbance. There is a severe thought disturbance. Fine, no problem. Apart from it, these schizophrenic patients, okay, they have, you can say, after getting the drugs, patient have something which is related with their motor functionality, okay. Patients develop the different types of, you can say, the motor abnormalities, and that is, as a group, they are called as the extrapyramidal side effect, which we will see. Extrapyramidal pyramidal side effect, also called as the EPSE. Patient have the, you can say, loses the control over their muscle tone. Okay, apart from that, patient have the abnormal, you can say, facial movement. Okay, and patients, all the muscle is freezed. Okay, so these are called as the extrapyramidal side effect. So this is commonly seen, this is basically called as the positive symptom of schizophrenia. These symptoms are actually, is not a normal symptom, this is not present in the normal person, so this is added in the personality. That's why this category of symptoms is called as the positive symptoms of schizophrenia. Fine. So for management of these symptoms, we are commonly administering the antipsychotic agents or antipsychotic drugs. Now talking about the negative symptoms, then here I said that there is something which is lacking, okay, from the normal personality, and that is these patients, they don't have the motivation. Okay, so loss of motivation is one of the clinical feature of schizophrenic patient, and that's categorized under the negative symptoms. Okay, apart from it, there is a flatness of the emotions called as anhedonia. Okay, anhedonia. Fine. And there is a social withdrawal, social isolation. So these are not present in the normal personality. Okay, this is not present, this is basically this is present in the normal personality. Okay, and this is lacking, that's why we categorize these symptoms as the negative symptoms. Now you can say the benefit of categorizing these symptoms in the psychotics, these schizophrenic symptoms, into the two types have the great importance. Okay, while we are using the drugs, antipsychotic agents. Okay, so for their management, it must be these antipsychotic drug must be the two types. The one category of drug which is typically managing the positive symptom of schizophrenia, and there are another category of drug, okay, which manage the positive symptoms as well as the negative symptoms. Now, what are they? So let's classify the antipsychotic drugs. The antipsychotic drugs are classified into the two types. The one category of drug, okay, is called as the typical antipsychotics. Typical antipsychotics. I hope you understand my handwriting. Yeah, it is called as the typical antipsychotic. Another category of drug is called as atypical antipsychotic. Okay, now they do have the different mechanism of action. Okay, then another category of drug is called as the atypical antipsychotic agents or psychotic drugs. Now, these typical antipsychotic drugs, they typically manage the positive symptoms. Now, what are those positive symptoms? Hallucinations, severe thought disturbance, extrapyramidal. Actually, these extrapyramidal side effects, basically patient develop the ataxia, okay, catatonia, fine, akathisia. These are the muscle abnormality, movement abnormalities. Okay, patient is frozen in a one posture. Okay, hours and hours. So these are actually the side effect of these typical antipsychotic drugs. These are the side effect of typical antipsychotic drugs, but they manages the hallucination, delusion, illusion. You can say the thought disturbance. They calm the patient. Fine. These are called as managing basically the typically the positive symptoms and showing strongly the extrapyramidal side effects. So that these drugs are called as the typical antipsychotic drugs, and these are initially discovered drugs. Okay, these are initially, so these are also called as the classical antipsychotic drugs, also called as the first generation antipsychotic drugs. No problem understanding. And their mechanism of action, for a while I am just giving you the brief explanation, but in our upcoming next lecture we have the detailed, you can say, discussion over this typical and atypical antipsychotic agents or drug. But for a while, just understand these typical drugs, they are strongly binding on the dopamine receptors. Specifically, if talking about this specific site, then it is a D2 receptor. So these drugs are basically the D2 receptor blockers. Okay, D2 receptor blockers. Fine, no problem. And they have the extrapyramidal side effects. No problem. Now, coming to the atypical antipsychotic drugs. Okay, don't forget, take the one example also. So the initially discovered drugs, and that is called as the chloropromazine. Chloropromazine. Another drug is called as haloperidol. Fine, no problem. Now, coming to the atypical antipsychotic drugs. Atypical antipsychotic drugs are a beautiful drug, first of all, because they won't show the extrapyramidal side effect. Okay, they won't show the extrapyramidal side effects. So, these drugs, they are called as the second generation antipsychotic or modern antipsychotics. They are called as the second generation, okay, also called as the modern antipsychotic. Now, they are managing the positive symptoms as well as they are also managing the negative symptoms. How they are managing, which we will discuss in our next lecture. But for a while, you just keep in your mind that these atypical antipsychotic drugs, these are the beautiful drugs. Why? Just because they won't show the extrapyramidal side effect. They won't show the movement abnormalities in the, while after the administration, they won't exhibit, manifestate, okay, and they won't have any adverse effect as a extrapyramidal side effects. Are you getting the points? Now, another thing about the atypical antipsychotic drug is that these drugs, they are not only, you can say, blocking or interfering with the dopamine, they are also, you can say, inhibiting, and they are strongly basically inhibiting the 5-hydroxytryptamine receptor, and that is called as the serotonin. So basically, the atypical antipsychotic drugs, these drugs blocking the 5-hydroxytryptamine, that is called as the serotonin. Chemically, serotonin is written as a 5-hydroxytryptamine. Fine. So they block the 5-hydroxytryptamines, but they do have the blockage, but that of the dopamine, but that is a transient for the slow time. Okay. So just let's quickly revise that these antipsychotic drugs are basically used to manage the psychosis. Okay, and commonly used, psychosis is commonly seen in the schizophrenia. Schizophrenia is basically a disease, okay, where the exact etiology is unknown. There is no any permanent cure, and it is as common as diabetes mellitus. 1% of the world population is suffering from it, okay. And schizophrenia symptoms is categorized into the two types. The one is called as the positive symptom, another one is called as the negative symptom. Positive symptoms are those symptoms which is added in the personality. Okay, normal person won't have the hallucination, but in the case of a schizophrenic person, they do have the hallucination. And the two types of hallucination, one is called auditory hallucination, patient continuously hearing the sound, okay, which is not there for the others. And there is the tactile hallucinations, okay. There is a tactile hallucination. Got it? Now, the another symptoms is the severe thought disturbance, and while administration of the topical antipsychotic drug, patient will have the extrapyramidal side effect, basically a different kind of motor, you can say, abnormalities. Now, the another symptoms is categorized under the negative symptoms. Here, something is, you can say, withdrawn from the normal personality. So, there is a loss of motivation, there is a flattening of emotion termed as anhedonia, then there is a social isolation or social withdrawal. Now, for management of these symptoms, we are commonly administering the two, you can say, classes of antipsychotic drug. The one is called as the typical antipsychotic drugs, also called as the classical antipsychotic drug, also called as the first generation antipsychotic drugs. Okay. The another category we have is the atypical antipsychotic drugs, also called as the modern antipsychotic drug, also called as the second generation drugs. Okay. Now, the typical antipsychotic drugs managing typically the positive symptoms. They are well to manage hallucination, delusion, illusion, or the, you can say, the thought disturbance. Okay, and they produce the extrapyramidal side effect, the motor abnormalities. Okay. Now, the mechanism of action is that they are basically blocking the dopamine receptors, D2 receptor. No problem. And classical example is the chloropromazine and haloperidol. Now, coming to the atypical antipsychotic drugs, this is the beautiful drugs. Why? Just because they won't show any extrapyramidal side effect. Means they have the very less motor abnormalities, got it? And these atypical antipsychotic drugs, they will interfere, okay, transiently with the dopamine, got it? But these drugs, they strongly bind with the 5-hydroxyltryptamine, and that is called as the serotonin, and manage both the positive symptom as well as the negative symptoms. Clear? No problem. Now we will, in the next class, we will discuss these typical antipsychotic drugs and atypical antipsychotic in detail, and also keep in one example in your mind. For example of the atypical antipsychotic drugs, you have the qutipine, okay, risperidone, and the another example you can write as a clonazepine, fine, and aripiprazole. These are the modern antipsychotic drugs, okay, atypical antipsychotic drugs, and it is a, you can say, these typical antipsychotic drugs are inexpensive, they are less expensive as compared to the atypical antipsychotic drugs. So typically antipsychotic drugs are, as said in the literature, they are commonly prescribed, okay, for financial purpose. No problem. Now, so let's summarize today's class. What we studied, basically we studied about the drug, okay, which is used to manage the mental illness, and those drugs are called as the psychotropic drugs. Then we seen the indication that these drugs are used in the different mental illnesses such as depression, mania, anxiety, psychosis, neurosis, obsessive compulsive disorder, some of the organic brain diseases, functional diseases, fine. Then we seen the classification that depending upon the primary use, the psychotropic drugs are classified into the different ways as antipsychotic, antidepressant, anti-manic, anti-anxietic. Getting the points? No problem. Then we discussed about the antipsychotic drugs in detail. We've seen that these drugs are commonly used to manage the, you can say, the psychosis, and the psychosis is commonly seen in the schizophrenia. We've seen the symptoms of the schizophrenia, positive symptoms, negative symptoms, and also seen the example. Now in our next class, we will discuss about the typical and atypical drugs in detail. So thank you for having me. Bye. Have a nice day.